I faced my mortality, and so now the best I can do is live my life as happily as I can be. I left after 11 years with the Department of Natural Resources. I left and bought a big sailboat. I moved to Texas, a big 42-foot sailboat. I developed this thing that I like to call, it's called typically authenticity. Recognize your authentic self. When I'd been telling a lie about my authentic self for almost 60 years, and then that was freeing. That I don't have any secrets anymore. I don't have anything to hide from anymore. I've faced my demons. My prostate cancer and my gender transition were intimately, related. And I might not have transitioned if I didn't think I had to. I might not just gone on enjoying my male privileges. You know, now I enjoy some female privileges, but not as many. And I'm a member of a discriminated against minority. My name is Eve Gamble. I'm 66 years old. I am a transgender woman. I'm married, and I'm fighting prostate cancer. I got diagnosed in 2017 when I was 57 years old. I'm 66 now. So, working on a decade. 2016, I went for my annual VA physical with my primary care provider there. And they did a PSA. I think it was a second or third PSA that I'd had, but it had gone up. It was a 4. And they didn't think it was of great concern. And then the next year, I went, and it was 12. And then it started going up to 18. And they said, we think it's cancer. So I had a biopsy. And they said this was a Gleason 5 plus 4, or a 9, which is what the maximum you can have for a Gleason score is 10, 5 plus 5. So there were a lot of cancerous cells in my biopsy. So they, told me what my choices were, radiation or surgery. So I said, well, let's just remove the gland. And they did. And it was, and it had all the things that were happen with prostate cancer surgeries. When they removed the gland, I lost my erection. They took the nerves on one side of my prostate gland, the nerves that control a male's erection, and mine didn't work anymore. It left me feeling less than male. It feeling like me, and I was always non-binary, and Jan always knew that, from our first date. Uh, but then when they said you can't have your testosterone anymore, we're gonna, and I started having these hot flashes, and I went through that something similar to menopause that males have. I call it androgenopause. That's my own coined word, I guess, but it seems to fit. And they, as I said, surgery and radiation and orchiectomy and nothing seemed to get rid of it. It was a rough few years, and I decided that I was going to gender transition. If I only have a few years left and I don't feel male anymore, and uh, I better live it authentically. So I went to the VA and told them about this, and they had a program through the DeBakey VA Medical Center called um, Bravely Going Forward, or something like that. And it was about what the VA does for their transgender veterans. My cancer was an aggressive one. It was a Gleason 9. and I did surgery in January of 2018, and my PSA didn't go all the way down, and the pathology report indicated that the margins were positive, and there was some cancerous cells in my bladder neck. And my PSA didn't go all the way down. They expected it to go to zero after they removed the gland. I call it radical prostate surgery, or RALPH actually. Uh, and they recommended adjuvant radiation. So I went and saw the radiologist. And they gave me a little tattoo right where they were going to hit their beam, and what they were aiming for. And I did, I think, 18 rounds of of radiation over a few months, and took its toll on me. Then surgery took its toll on me also. Uh, and the cancer still didn't go away. My PSA went down to 0.15. Then it started climbing back up. And before we knew it, it was 4.5, 4.5. And, and I said, well, testosterone is not my friend. And I was already non binary. And I had begun my transition hormonally. And uh, so I decided to go for, if I don't need my testicles, they're not my friends anymore, let's cut it off at the source. So I did a bilateral orchiectomy. Had a difficult time with that surgery. My body did its job, and I started feeling better, but it still didn't kill my PSA. It took it down a little bit more, but it still didn't kill it, and it was still rising. So urology says, we've had enough of you, Eve. So long, we're sending you to the oncologist. So I went and saw an oncologist, and the first oncologist that I saw, her name was Yvonne Seda, and she talked to me because I'd sent her an email before my consult with her, that I'm a trans woman and I'll be presenting feminine, and these are my pronouns, uh, and I hadn't changed my name yet because you have to wait a while before you can do that. So she was still seeing my former name and my chart and everything, and she wasn't sure how to deal with a trans woman at a traditionally male disease, and that's sort of the crux of this discussion, because it puts me, and it wasn't what I really liked, but uh, a scientist in me says, well, Eve, it's just a collection of bad cells in your body. It doesn't define you. And it didn't. So I told her that it didn't define me. She sent me to another oncologist, referred me to another oncologist, Dr. Chin, and he's with Rice University, and he really knows his stuff. And he saved my life. I got it down to nothing, and I've been on it for 4 years. I've gotten older, and I'm surprised that I survived this long. Or really, as aggressive as my cancer was, I thought, well, maybe 2 years. I made some changes, and I'm happy, and I'm trying to keep a good attitude. My cancer hasn't killed me yet, and as far as I know, my PSA is still negative, or not negative, but zero, close to zero, undetectable, they say. My reaction was just rationalizing as a bunch of cancerous cells in my body that don't really define who I am. I didn't have much control over. I'm not a big believer in free will. I think things just happen. Even even before a thought comes to my head, there are chemical reactions going on and neurons firing. And before it comes out of my voice, and I wish I hadn't said that, I didn't have any control over it. I didn't control that I have cancer. I didn't control that I'm 6'2". I didn't control who my parents were, or what my zip code was, anything, or that I breathe, or that I live. So I'm just part of it all, and I'm enjoying being part of it all. And to me, that's kind of spiritually fulfilling in a way, because it makes me think that I am everything. I'm connected with everything. Everything that's in me and you was always here ever since the big explosion, and it was somewhere before then. And we're all evolving, and we're all growing, and we're all going to die. And it's like, let's enjoy and get our kicks while we still can, and so um, in terms of answering the question is, did I have a big problem getting a male disease only in as much as I had to come out to myself. And I knew that I was non-binary, but I had to come out to the world when I transitioned. And it's not just me coming out to the world. Not just all my medical providers are trying to go stealth and blend in. I don't blend in, and I don't care if I don't blend in. I'm just going to be me. Everybody's got a little ugly in them, and everybody's got a little pretty in them. And nobody's perfect. I just decided I'd be my authentic self. My prostate cancer was influencing me and to live more authentically, to live more honestly, to to be braver, to have greater confidence, to be uh, a richer person, you know, a more beautiful person. I hope, and that's been a gift. But with my diagnosis, I felt like I got lemons and made lemonade. What I would like to help happen with treatment, with therapy, with doctors, with the healthcare profession, with the labs, with the technology. Of course, I'd like them to find new treatments that address prostate cancer without androgen deprivation therapy. That's what the but I'd also like to quit talking about, for the whole profession, to quit talking about men with prostate cancer because it's not necessary. And I don't consider myself male. Why don't we talk about people with prostate cancer? Why don't we talk about patients with prostate cancer? Why don't we talk about individuals with prostate cancer? And why all the mispronouns? You know, why do you have to correct them? I'd like to change society so that they realize that pronouns are important. And I correct people when I get misgendered. You know, I go. No, I just correct them. I laugh at. Try not to. I mean, I used to get irritated. Now, only if it's done meanly, cruelly. If it's an accidental thing, I just correct them and float right down the road, being a little butterfly that's bouncing around from flower to flower, but not pollinating much. And uh, so I think that the community at large, why I'm doing interviews like this, is so that we can talk about patients with prostate cancer and recognize that trans women exist and they also have prostate glands. Even after gender assignment surgery, they don't remove the prostate, they keep it. Um, and so I'd also like to educate more people, more trans women, exactly, to get their PSA checked, to monitor it. And I'd like to encourage the medical community to be aware that trans women have prostates too. Ask people what their preferred pronouns are. Ask, put it on your list. Preferred pronouns when they fill out your admission sheet, or your medical information or your history. Ask what your pronouns are. Make that part of the whole program. Pronouns, pronouns, pronouns. And then use them and practice using them. Secrets are toxic. Secrets, closets are no places to be. Closets are places where you keep your clothes, not where you live. They're dark and they're cramped, but authenticity. Authenticity is that feeling of just knowing who you are and being who you are and being comfortable with who you are. It's such a gift. It's a gift that you give yourself, and 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 celebrate yourself and love yourself. I mean, I still have some masculine traits. I still have my masculine memories, and I sort of learned to love myself as this magnificent blend of masculinity and femininity. Whether it's magnificent or not, it is to me. And I like that I've been able to do that with myself. So celebrate, love yourself. If you don't love yourself, ain't nobody gonna love you. Go have fun. Explore it all. You know, go and enjoy what you like.